Hello and welcome to NSG, where it's about country and people. This is the Hot Seat. I'm your host, Selassie, and it is said vaccine war has reignited. I'm not sure why it's said vaccine war, but that's what is being said from some channels from around the world. The vaccine war has reignited. We're back on the NSG, the hot seat. Proud to our previous video where we called the Ghana Ministry of Health and the Ghana Health Service to question as to why in 2023 they are still pushing. And as I've been reliably informed, on the Citi FM, it's been said that the Ghana Health Service is about to embark on a mass vaccination exercise. Which vaccine? The COVID vaccine, that is raising questions from all around the world of the health concerns that is associated with the jab. Apart from that, the ineffectiveness of this jab. How it is now seems to be, we've been lied to, deceived, bullied, psychologically and mentally tortured, coerced into taking the jab. How the pharmaceutical companies have made billions, in some cases over 100 billion, on the back of the health of human beings from all around the world. We're back because there is a new development. In the most recent Davos, if it's still going on, I'm not sure. The Pfizer CEO has been, I'll put it this way, he's been cornered by some group of journalists. That is proper journalism when you're looking for the truth, the facts of a matter. And some very interesting questions were asked, but he refused to answer. On the NSG, the hot seat, we will show you the video and you listen to the questions asked and you decide for yourself what it's going to do in Ghana when our medical or health service leadership decides, for whatever reason, to embark on mass vaccination exercise irrespective of the health warnings. The question is the Ghana Health Service, the Ghana Ministry of Health, ignoring the health warnings associated with the COVID injection? Have a listen to the video and we'll be right back. This is the hot seat.
Mr. Borla, can I ask you, when did you know that the vaccines didn't stop transmission? How long did you know that without saying it publicly?
Thank you very much.
I'm sorry. Answer that question. I mean, we now know that the vaccines didn't stop transmission, but why did you keep it secret? You said it was 100% effective, then 90%, then 80%, then 70%. But we now know that the vaccines do not stop transmission. Why did you keep that secret?
Have a nice day.
I won't have a nice day until I know the answer. Why did you keep it a secret that your vaccine did not stop transmission?
That was Rebel News' Ezra Levant questioning Pfizer CEO Albert Bourla.
Welcome back. So you've heard for yourself. Very interesting questions were asked and the CEO refused to answer. Why? These are basic direct questions. These were the same individuals that came out to tell us how effective these injections were. How the world was coerced with fear to accept these injections. But he refused to answer. Now, so we've come to the Ghana Ministry of Health, Ghana Health Service, and the expanded program of immunization. We are also back to them with the same questions. What could possibly be the reason in 2023 that Ghana Health Service wants to embark on a mass vaccination exercise of the same jab that is labeled to be injurious? Is our leaders disregarding the provisions within the Health Act 851? We are also putting the question to our health leaders. Did they know that they could be criminally liable if it is proven that this is deliberate? It is unacceptable that the Ghana Ministry of Health, the Ghana Health Service, and the expanded program of immunization is ignoring the warnings around the world. Even in the UK Parliament, the dangers of this injection was debated and is being looked into. Reports are coming from different angles and cortices. Health issues, sudden deaths, stillbirths, miscarriages. I can continue with the list. NSG, the hot seat. We know Ghanaians, you are intelligent, you are smart. Source information for yourself. Don't allow our Ministry of Health, the Ghana Health Service, and the expanded program of immunization to coerce you into doing something that you will regret the rest of your life. Because if it goes in your body, it's not reversible. We thought to follow up on our previous episode, asking the questions, is our Ministry of Health leadership compromised in some sort of way? Because the questions asked the Pfizer CEO also suggest that they profited at the back of the health of us humans around the world. And actually, he seems not cared. He said to the gentleman, have a good day. The gentleman said, I'm sorry, no. I am not having a good day until you answer my questions. And if I were, I would say same. Because our health is at stake here. And this individual seems not to care. And it seems our Ghana Health Service, the Ministry of Health, and the expanded program of immunization, they also seem not to care. Because in 2029, if they are preparing to embark on a mass vaccination exercise in Ghana, what could possibly be the reason? We said previously, the COVID virus is downgraded to a normal flu in some parts of the world. What could be the matter? What could possibly be the reason? Not only that, in some reports from the India, where Pfizer was trying to push them into signing to indemnify them against the vaccine or the jab that they were providing them, suggesting that some of these jobs are expired because the temperatures at which they were kept, it's not appropriate. Which one is Ghana wanting? Is it new ones or the existing ones since 3 years ago? Could our leaders be that careless with the health of Ghanaians? Wake up, Ghanaians. Your body, your choice. Don't be afraid. Don't be pushed with fear. Africa, Ghana survived this COVID virus with no mass injection. And now that the disease is said to have become a normal flu, you're smart, you're intelligent, that I do know. Make your choice, make your decision, and don't follow our leaders blindly. I don't want to go through the questions the gentleman asked. This is why we play the video for you to hear the questions the Pfizer CEO. I remembered at the peak of this COVID coercion, bullying to the public through the medias, the mainstream medias who have refused and up to now are not carrying the news, this major news that is coming out. One of the CEOs of one of the companies, I don't want to speculate, but on CNBC was asked the question, has he taken the job? He said, no, I'm healthy, I'm sound. We want people with higher priorities to take it first. The CEO did not take the job and was giving excuse that he was healthy. So why are you injecting all healthy, sound human beings around the world? Why is Ghana wanting to inject sound, healthy Ghanaians? Because from that session on CNBC, which I believe I have the video somewhere, was saying that he did not take the job because he's healthy and sound. Why should in 2023, the Ghana Ministry of Health and the Health Service be planning to embark on a mass vaccination exercise with the same job? That is said to say, if you are healthy and sound, you don't need it. If you have a natural immunity, you don't need it. What could possibly be the reason? What could possibly be the reason? Dr. Kweku Ampusa Achianu, EPI manager. Dr. Kweku Abuaji, Director General of Ghana Health Service. What could possibly be the reason? Dr. Kweku Ajimamenu, the Minister of Health. What could possibly be the reason you want to do this to Ghanaians? Remember, if it is proven you're doing this for your personal gains and you are aware of the developments from all around the world of the dangers associated with this job and you're going ahead to push it on Ghanaians, you could be criminally held liable. You had a question asked to the Pfizer CEO. You could too. Where is our Food and Drugs Board? What are they doing? The Ghana media is not boarded. They are there dealing with superficial matters of national cathedral when the health of Ghanaians is at stake. Could our media also be compromised? They don't care to be asking questions. They're not bringing the information to Ghanaians. What is going on and what has become a common knowledge that there is health issues associated with the job. It's a failure of our... On the NSG, the hot seat, we love Ghana. We love the health of Ghanaians, and this is why we'll keep bringing the information to you. And we hope Ghanaians are interested and listening to these things for their own health. So our health ministry and health service is ignoring the provisions within our Health Act, Section 21 and Section 25 about the natural immunity. Actually, since the takeover of Twitter by Elon Musk, there's been files released about the communication that went on between some of these high-level or high-ranking officials. And it seems that they do know about the effectiveness of natural immunization, but there was this movement to stop doctors, virologists, physicians with knowledge of what was going on from making people to become aware, to encourage them or to coerce them into taking the job. It's out there. If you want to find out, go. Our parliament, the Ghanaian parliament, nothing has been said from there so far. Apart from the questions of Ajimamenu procuring vaccines without authorization? What about the health warnings that has come that seems that our health leadership is ignoring these things? The fact is, we've been lied to, we've been bullied, we've been coerced, our jobs were threatened from all around the world. Is that just for profiting? You mean you can ignore the possibility of death, sudden death, heart diseases, strokes, just for profiting? I can only label that to be wickedness. How much more? Just like the gentleman was asking, how much more boosters do you need the world to take for you to be satisfied with your profiting? Over 100 billion profit. And yet, there are some human beings in some courtesies who are still arguing and fighting the need for us to put these things in our body. From the start, some came to warn that this is a genetically modified injection. Oh, some say it is not. Now it is. It's a common knowledge. Even when the brainchild, Dr. Malone, said what it is and should not be given to children, it was questioned. We have the link of the debate in UK Parliament in the description. We have the link of Dr. John Campbell, very diligent and meticulous in his materials, giving statistics, in some cases, very worrying statistics of excess deaths, apart from the reports of sudden deaths, heart attacks, even stroke, and all other neurological issues. These are first-hand reports from individuals that participated in this exercise. At the time, some of us were shouting from the mountaintop that the world has become a guinea pig because at the time, these jobs were not approved. They were released under the emergency use authorization. So the whole world has become a lab. Here we are. I'm sorry. And we have the link to the video where the Pfizer CEO was being chased for answers because the world and Ghana is concerned with what has been put into our bodies. Dr. Kwame Amposa Achianu, the EPI manager. Dr. Kuma Abuaji, Director General of Ghana Health Service. Dr. Honorable Kweku Ajiman Menu, MP and Minister of Health, or Minister for Health. We're watching you and we're calling you out to say what could possibly be the reason you want to do this to Ghanaians in 2023. Irrespective of all the fresh information coming out, including the Twitter files. We thought to bring it to your attention, the new development. Till we come your way, God bless Mother Ghana. Long live the Fourth Republic. And please do us the favor. In the interest of Ghana must work, Ghana can work. We want Ghana to work. Subscribe to the channel, hit the like button, and forward to other Ghana-loving Ghanaians. You've listened to this, you've heard it. Don't assume the next door neighbor in Ghana knows about this. Forward it to them so they are well informed. Lack of knowledge, my people perished, is what I know. It will do you a lot of good to source information and be knowledgeable in the things that pertains to your life and your health.